Delighted to have you back, Dr. Stacy Sims, on our podcast. What a treat it is to have some airtime with you. Thank you so much for joining us today.
I always look forward to that even that I get to see my friends. See who's my friends.
Oh, seriously, you just warmed my heart there. Thank you so much. It's awesome seeing you too. I can't wait till, we can actually see you on US soil again. That'd be awesome.
Soon, end of
All
the
right.
year.
Good.
All right.
That's so great. I know when we last got to see you on our podcast was almost 2 years ago now. Next Level hadn't, I think it was just being released, published. Anyways, 2 years is like light years, it seems like. Could you provide us a few updates of what you've been working on, research, other projects, or other, updates from you?
I disappeared in a blur of 100 and some odd days out of New Zealand conferencing. So I can't really tell you what all was happening last year other than going across the world talking to people about menopause, which was fantastic. But from that has stemmed some really interesting projects. Most of it is the fact that all the women that's coming out, it's really being directed from the lens of the cis white woman, and it's not looking at other ethnicities, other socioeconomic status. So we've picked up a couple of grants and written a couple of grants to look at the perceptions of just menstrual cycle, like menstrual fluid. We're doing analysis of menstrual fluid against serum to see what are risk factors. And first, we have to understand how people perceive what is menstrual fluid. How do I feel about that before we can launch into making something like a smart tampon? And when we were talking about peri and postmenopause, symptoms are different depending on how you grew up, how your mother perceived it, if anyone talked about it, what your socioeconomic class is. So we're doing like a whole bunch of the sociology perspective within this research. So I think almost all of our research projects right now that stem from product development to like basic understanding of puberty to early teens is all based on perception and what people know and don't know. Because I feel like we can't really push anything forward till we understand what education really needs to be done.
I don't even know where to go with that. Cece, it's huge. I mean, I bet even just mind blowing for some, like, oh, wow, I never thought of even menstrual periods outside of what we've, our own little lens, right?
I know. It's interesting because I never really would have thought of it until one of my good friends is a professor in sociology, and she does all the female extreme sport. And so we started having this conversation about the toxic sporting environment and the lack of the ability of female athletes to have this discussion. And we're like, well, what is really the barrier of the discussion? Because menstrual cycle is a health thing, it starts to go away, the undercurrent of red S or red. And so what is it? What is that sticking point? And it comes back to how the women themselves have grown up or what their cultural nuance is around menstrual fluid. I was like, we need to really nail that to then be able to transcend this barrier of education and conversation.
Yeah.
I wouldn't have thought of it until I started working with a sociologist.
I was just thinking, I have a background in anthropology and just thinking of like the overlap to other sciences as well, like you're saying,
Yeah,
socioculturally and things of that nature, opens up a whole, 500 other doors to our learning.
yeah, there's research available now.
Well, I'm just thinking of the menstrual cycle. This is reminding me of some other things since we last got to spend time with you. The whole buzz about menstrual cycle syncing, and please bring in any of the other aspects that you were just alluding to here as relevant, but just some of the controversies in the research findings of the research that's been done or the meta-analyses that have been done and maybe limitations there and how I'll let you talk on that perhaps, but just wondering your viewpoints here with regard to aligning training with the menstrual cycle, or how does the nutrition piece fit in here, the gaps?
So in the political world of sports science, you have those that are applied scientists and those that are like lab-based scientists. So when we're seeing all these systematic reviews coming out saying that there's no evidence to say that there's any effect of the menstrual cycle, this is based on a very small criteria, small studies that have all been done in the lab. When you start taking the applied science and you start looking at things like psychology, behavioral psychology, field studies, case studies, and you apply it, you're like, how can you say there is no effect of the menstrual cycle? We see that there is a definitive effect of the menstrual cycle. You talk to any professional athlete and they will tell you. What we can't say is that everybody should do X, Y, Z on day 1, day 2, day 3, right? So that's where I think the whole debate came, is that we started seeing these really specific, and I can take ownership of some of that too, because I was looking at the basic physiology and we were saying, okay, well, we see these studies where when we have low estrogen or estrogen rising, we see that there's more satellite cell development and we have better carbohydrate utilization. So what we have come to really learn when we start applying things outside of the eumenoric cis white woman, and we start seeing differences within the menstrual cycle, we see ovulatory or anovulatory, we see PCOS, we see heavy menstrual bleeding. We take all of those into account and we bring it back down to the individual. So the best advice that we have about menstrual cycle training is you need to track your own cycle and find your own patterns and understand that when you start to see a change in the actual bleed pattern, then that's a really big red flag that something is wrong. Because you can still bleed when you have an anovulatory cycle, but that bleeding is going to be different than if you were to have a bleed with an ovulatory cycle. So if you're able to track your own cycle and understand your bleed pattern, then that gives you more insight of how you are being stress resilient. Are you adapting? Are you not? We also see that some women can push harder in the luteal phase. Some women can push harder in the follicular phase, but you have to really understand your own patternings there.
Mhm.
So when we're talking about menstrual cycle effect, we train according to our menstrual cycle and how that makes us feel and how we can track it. But know that when you're looking at performance on the day, we see the biosocial and the cultural and the psychological all supersede the hormonal influences. So it's basically, if you're looking for your A race and you're a coach and you're going to tape your athlete down so that they're flying on race day, it's the same thing. Like, you're looking at the menstrual cycle, you understand that, race day happens on the day that I feel really, really super flat. But in advance, so you can put interventions into play to reduce that flatness and then give your athlete that mental boost to be able to overcome any kind of perceptual impact on performance. So I think those are the nuances that aren't being discussed, especially when we have these systematic reviews. I get so many emails a day where women are saying, I can't talk to my coach, I can't talk to my PT about my menstrual cycle because they say, oh, there's no effect. It's disempowering women when we have these voices coming out saying there's no effect of the menstrual cycle based on a very small criteria of systematic reviews. We have to look bigger than what those systematic reviews are coming out. And we have to look at more than just a very small amount of sports science research out there.
Yep. I can feel the fire. I feel it.
Yeah.
Along that path, Stacy, in regards to the nutrition and kind of following, yeah, the individual tracking and things, are there some changes in the research findings or in your own research and things that you've put together? I'm thinking of just when we last saw you 2 years ago now, along those lines, like with the macronutrient shifting based on cycle phase, or is this kind of going like overlaying some of the individual experience along with what we know happens physiologically as a response to hormonal shifting?
We published a female athlete position stand with the International Society of Sport Nutrition just at the beginning. Oh my gosh, last year, January-ish last year. And doing a deep dive into that, there is still differences between the menstrual cycle phases, but it's based on ovulatory status. So first thing with ovulation and progesterone is a driver for so many things, like a change in protein needs, a change in carbohydrate availability. So if a woman is regularly cycling and ovulates, then yes, we see that you need more carbohydrate availability in and around the luteal phase. We need around 12% more protein intake. We need a few more calories, all because the body is building that endometrial lining. And we see a shuttle of carbohydrate into the endometrial lining to actually create a really robust glycogen storage area. We're also, again, building tissue. So we're using amino acids, we're using all those building blocks to build the tissue. If you don't ovulate, you don't produce progesterone, you're not having the stimulus to build that tissue. So it's ovulatory status that's really important to understand. But because it's so hard to figure out if you have ovulated or not, we just use the basic of, we are going to make sure that you are getting all of your carbohydrate. We're periodizing that carbohydrate. Women need more carbs than men. We see low energy availability, signs and symptoms are pretty similar to low carbohydrate availability. So making sure carbohydrate is there in and around training during the luteal phase, either ovulatory, we don't know. So we're just going to say, yes, we're just going to keep this pattern going. We need to have more carbohydrate in and around training in the ovulatory phase because women use blood sugar first and then get into free fatty acid use where men use blood sugar and glycogen. So there's a little bit of a shift there. So we need to make sure that carbohydrate is available. We also need to make sure that protein is available, not only for lean mass development, but also for neurotransmitters and some other metabolic aspects that amino acids are used for.
Mm-hmm.
And then, you can look at supplements because that's also a big question. And there's really a significant lack of research on supplementation for women, aside from creatine. And we see that beet juice and nitrates is an age dependent. So we see in younger reproductive women with fluctuating estrogen, it can have a negative effect on VO2 and oxygen carrying capacity. Whereas when you get into late peri and into postmenopause, it works really well. And that's because estrogen is tightly tied to the nitric oxide capacity in the endothelial tissue, which lines blood vessels. So if you're providing nitrates, you have a miscommunication between your natural responses of estrogen driving blood pressure and vasodilatory control. So when you get into postmenopause and you have difficulties because you have less vascular compliance, the nitrates work really well. Also finding that for women who are having a lot of heat intolerance when they get older, that using some beet juice before they go out training increases their heat tolerance because they have better blood pressure control with vasodilation and constriction. So those are like the two big things that have come out recently. And so all the other stuff with beta alanine, we don't know. With caffeine, that again is genetic dependent, not gender dependent or sex dependent. So there's really interesting things that are coming out along supplementation, but again, it's that education and the transference that still needs to
Mm-hmm.
happen.
Do you think, Stacy, like in your crystal ball, eventually we may have some other than recommendations for I'll say that people other than cis white individuals?
I hope so. I hope
Yeah.
so. I got latched, like, or really significantly backlashed on a note that I put in the second edition of Roar. Because,
I saw that.
you saw that, yeah.
Yeah.
So just trying to be as transparent as possible to say, I understand that there's transgendered out there and there are transgendered athletes out there, but we don't have any research besides hormone therapy research. So what's in this book, unfortunately, is geared towards cis women. You can definitely read it, understand it, and apply it to you as it fits, but I can't say it's for every woman. And so when we're start to getting into the nuances of research, I always refer back to my mentor, Marcia Stefanik at Stanford, and she teaches classes on transgendered and sex differences and everything. She's very open-minded. She always gets the question of what about transgendered athletes? And she's like, wait, we don't have enough research on women's health in general that we can't start partitioning out these other voices because it splinters us and we lose the ability to bring everybody together to have really robust research to have a foundation to then go out and look at the subpopulations. I was like, I love that. Thank you.
Yeah.
I hope people don't get mad and cancel me for saying that, but that's the reality of the situation.
What you said is just gold. I mean, it really is. And it
Thanks.
kind of, I mean, honestly, it kind of sets we are frustrated sometimes because things don't go as quickly as we want. But listen, I mean, that's the world. I mean, it just doesn't happen with research. So I love what you said there and like keeping us together as a community and doing this together. And eventually we will have some answers Stacy, I want to roll back the clock a little bit because we do talk a lot about perimenopause, postmenopause, which is awesome. And listeners, just bear with me for a few minutes here. I'd like to roll back the clock and talk about our young female listeners and maybe the parents of young females. So specifically, I'm going to talk twofold. The first category is our teenage female athletes who are still going through puberty, right? And then I'll stop there because then we're going to talk about collegiate female athletes. But what do we like? What is your take? What do we know about these teen female athletes? Could be any sport, obviously. They've just started menstruating. They're not post-puberty yet. Like, what's going on, and what messages do we send to them to learn more about their body?
It's a question, because we've just put together an entire course on it called
Oh,
Next Gen.
perfect.
So, I'm very excited. So when we're looking at the youth athletes, so we know, puberty in girls, we start to see changes as early as 6 to 8. It becomes
Mhm.
really apparent around 10-ish. And that's when we start to see this big shift in the want and need for physical activity. So when we're looking at what's happening before the actual period comes, we're seeing a change in body composition. We're seeing changes in neurotransmitters and mood and self-efficacy. We're seeing a change in thought process where they're leaning more into their friends instead of listening to parents and listening to like coaches. And they have this absolutism around them where
Mhm.
it's all or nothing. There's no gray area. And we're trying to communicate like we need to be physically active. We want to enjoy how we move. It's more about showing a role model. So then they're like, ah, I love this. This is where I'm going. And they become absolutist about it. But you have to find what is that driving factor. Is it soccer? Is it cycling? Is it running? Is it what is it? Right. So we find that role model and then we backtrack from that role model to explain how they got there. We say, at this point in time, we want to work on functional movement and development because biomechanics are in the process of changing. It changes over the next few years. Body composition and body morphology shifts along the way. So it's just this temporary point in time of development. But what we want is that build that foundation of really good movement patterns. So it can be in the gym where they are learning with a PVC pipe to squat to a box. So they're getting their knees and feet and ankles in the right alignment. Or it could be doing obstacle course type training, because you're on the jungle gym, we're doing monkey bars or doing all that kind of stuff. It's still physically active, it's still functional movement. And I think when we start looking at what parents want versus what the kid wants, we see this huge drive of so many helicopter parents and soccer parents, and we want our kid to be excellent. But we know through research that if they're pushed to this whole puberty and teen point, they don't go on and become Olympic athletes. We don't see people becoming that kind of competitive drive until they're in their late teens, early 20s, and it's their choice. So supporting through this and making sure that they're eating well, we're not demonizing any food, we're not having any kind of eliminations, we're letting them have their own choices within reason. And from a physical activity standpoint, it's all about the functional movement and multi-directional because we want
Mhm.
their body to be able to move in so many different directions. So whatever sport they go to, they're able to be successful to a point without putting in extra specific training, if that makes
Mhm.
sense.
Absolutely. Yeah. And do you see, I mean, I see a lot more younger females starting to be encouraged to be on some type of birth control in those early years. Are you seeing that? And can you speak to any messages you send to parents or young athletes, young female athletes who are either contemplating or already on birth control at that time?
I think it is one of the worst possible things that can happen. I think it's a
Mm,
mismanagement of medicine. It's the same as when someone like Peter Attia is out there telling every woman over 40 needs to be on menopause hormone therapy.
mm,
It's just this idea that hormones, right? So we don't, we're very lax in our robust research into oral contraceptive pills and hormonal contraception outside of the reproductive scope. But we are starting to see more and more come out with brain development, neurological development, and they're finding that when people are put on OCs, it changes the volume and the structure of the brain.
mm,
It's reversible, But when we're talking about that brain development in and around puberty and teens, because the brain is still developing, we're still getting neural pathways, there's that question of, is it going to change it and make it less optimal if we're using an OC? Because we know it's reversible in adults,
Mm.
but we haven't seen that in kids yet.
Mm.
And the other thing is, you really have to ask, why are we using an OC or hormonal contraception? Is it for contraception? Okay, that's a different conversation. But if we're
Right.
looking about controlling menstrual cycle, that's not right. Because menstrual cycle is very irregular. Heavy menstrual bleeding is something that needs to be checked out. It's not something that you mask with an oral contraceptive pill. If we're looking for skin, which a lot of, young teenage
Hmm.
girls want to go on OC for skin, you talk to a dermatologist, because there
Yeah.
are way better options from a dermatology point of view rather than putting people on hormones. So there's so many things about the oral contraceptive pill we don't know outside of reproductive status, but the stuff that is coming out that's not reproductive makes me have a huge pause on, and really want people to step back and say, is this appropriate for a young developing body and brain? And
Yeah.
from the science point of view, it's not.
Yeah, it seems like, me being the outsider looking in, it seems like we almost want these females, just like you said, like if something is happening, go see those specialists. Just don't just jump right to the oral contraceptives or birth control. But I mean, in my mind, which I'm going to shift into my next question here soon, but in my mind, we want these young females to learn about their bodies, learn about what's happening during that phase, because once, I work with a lot of collegiate female athletes, and once, I see these collegiate female athletes, the first question that I ask them, and, thanks to you, is, do you track your menstrual cycle? Because I want to understand that. And I don't know what the percentage, it's a high percentage, maybe 80, 90% are looking at me dumbfounded, like, well, no. And like, why would I do that? You know what I mean? So
Yeah.
I guess shifting to the collegiate female athlete now, they're post-puberty, let's just assume they're post-puberty. Oh, this is probably the most confusing thing I deal with, and I work closely with our medical director at this university, and she's just, a lifesaver with this also. But birth control, nutrition, tracking cycles, and birth control is all over the place with the different types, obviously. I don't even know how to pose a question to you, Stacy, but what do you say to what are your messages to collegiate female athletes? Are they different than our high school or middle school female athletes?
Little bit, because when we're getting into the collegiate athlete, most are reaching for birth control option,
Mm.
but then also being able to manipulate their cycle. So I often sit down and ask, I'm going to have a frank conversation and say, why did you choose this form of birth control? I want to know what the drive is. And again, that's the sociology work that I've been doing to understand why someone is doing something, because that's a question that's not asked. Once you
Mhm.
understand the why, is it that you have been given an oral contraceptive pill because you went to the collegiate doc and said, hey, I need some birth control? Do you even know what the estradiol dose is? Do you know what the generation of the progesterone is? Most don't, because the doctor doesn't. So you have that little bit of education and say, okay, well, if you're on a 20 microgram dose of estradiol, it's not going to have that much impact on lean mass. But if you're on a 30 microgram dose, you can put on lean mass, but you're not going to get strength.
Mhm.
So what are we doing here, right? So if we're looking for birth control options, there are many that we can look at. We can look at the IUD, which is very, localized if we're looking at a marina. And it's a fit and forget. A lot of my tactical athletes use it because they don't have to worry about having a period. You can still track your own cycle with basal body temperature if you really want to dial things
Mhm.
in. If that's not an option, then we can look at an implant, we can look at the depot, or if those aren't options, then we can look at the kind of oral contraceptive pill you are using to make sure that the formulation is appropriate for what you need and what you want to get out of your sporting career. But those are just, really in-depth kind of, let's talk about these things.
Mhm.
That's not happening. Yeah, and it's
Yeah,
hard too, right? Because most of them don't know. They're just like, oh, I'm on the one that they gave me. Well, most are
exactly.
a monophasic 30 microgram dose, and they don't
Right.
realize that putting weight on is muscle weight, but it's not functional strength weight. So if I
Yeah.
look at track cyclists who now all of a sudden have really massive quads, but they can't lift anymore in the gym. I'm like, my Olympic lifters, it's the same thing. It's like trying to make
Mm.
weight class. So we have to manipulate a little bit around that. If they say they're on it for a health reason, because of endometriosis or
Mhm.
PCOS or something like that, we can work with that too. So it's just really understanding the how and why. And if they're like,
Yeah.
I don't know, just on it. And it's like, okay, well, let's try to get off it so we can understand what your body's doing, how it responds to training, points where you get stressed or don't get stressed. Are you in low energy availability? All of the things that a menstrual cycle can tell us.
Yeah. Now, here's another question. Knowing resources at the collegiate level sometimes are really not there. Let's just say it how it
Mhm.
is, right? Would this conversation, like, would you recommend these female athletes have this conversation with their personal OBGYN or the medical practicing physician at that university? Like, who's the best for them to approach to be able to open these conversations?
Sports doctor, really?
Okay.
So if you're talking to a sports doctor and they're like, well, I want to be able to help you, but I don't really know who or
Mm,
how, then they can refer out because an OB won't necessarily know. A
mm,
general GP definitely won't know. So I always go with a sports doc for collegiate athletes, but they can also start on Catherine Ackerman's website. So
mm,
at the Boston Children's Hospital, the female athlete program there associated with Wu Tsai, they have some fantastic resources on there, both for coaches and for athletes. And so does Viz, Voice in Sport with Steph Strack. I don't know if you guys are familiar with them or not, but they have really good resources for the around the 12 to 22-year-old female
mm.
athlete so they can
Okay.
go in and they can find the resources, they can find an expert to talk to. So it's really trying to bring all of that to the athlete so the athlete doesn't have to go through someone that they're a little bit like, I don't know if I can talk to that person about it.
That's fantastic. We'll be sure to have that in our show notes, Dina, for sure,
Yeah.
for references. Yeah.
Yeah. Thank you for
Cool.
that.
Yeah.
Stacy, maybe we could transition to the topic of protein, one of our favorite topics, in line with the consensus statement that you put out with the ISSN and things that are still lacking in the research. Can you provide a few updates, or maybe it's some reiteration of some things that are still, still going with regard to the importance of protein around training and maybe the use consideration of amino acids?
Almost every woman or maybe every athlete is under proteined because we've had this big thing, like well, it's all through the 80, low fat, don't worry about protein, get your high carbs, and they're all switched. But when we're actually looking at protein and the recommendations of protein, like I dug in to find out where did these recs come from
Mhm.
originally, and they all stem from what did the basic person need to not get into malnutrition
Mm,
when World War One started because there was calorie rations. So the RDA out there is your basic minimum need without any activity so that you don't fall into malnutrition. I was like, And then the women's recommendations are just scaled down from men's based on sedentary older men of 65 or older because they had quote similar body composition. I was like, how does that appropriate? So then we start seeing newer research that's coming out. First, it was about the endurance female athlete, collegiate. How much do they need doing nitrogen studies? And the bare minimum for 4 times a week collegiate athlete is 1.6 to 2 grams per kilogram per day to put them in the good range to stay healthy. When we start looking at post exercise protein, there was a study that came out maybe 3 months ago looking at that post exercise dosing for women, and 20 did nothing. 35 and 60 maintain muscle protein synthesis over a 24-hour period, but the 60 gram didn't do anything more than the 35 gram.
mm,
So they're like, okay, we need 35 in our premenopausal women who are recreationally active post exercise within 35 to 40 minutes in that acute recovery phase. We start looking at older women that peri into postmenopause. 20 does nothing, 35 is right on the tipping point, but 40 tends to be the sweet spot between 40 and 60 post exercise to maintain that anabolic stimulus for
mm,
lean mass development. When we're looking at what kind of exercise, We see that with strength training because it's not fuel depleting like endurance exercise. You can split that. So Abby Smith Ryan's done some really cool work with Sam Moore over at UNC and found that you can do 15 grams of protein before, and then that around 20-gram post, and it feeds forward into better strength training capacity during the session and increasing metabolic rate and muscle protein synthesis post. For an endurance session, you need that 15 grams plus 30 grams of carbs before you go out on your endurance session, anywhere from 90 minutes to 4 hours. And because it's so fuel depleting catabolic, you do have to follow it up with the full dose of protein with carbohydrate afterwards. So when we're looking at all the different recommendations out there and people come back and say, 0.8, it's like, that's not enough. Double it. If you're just on
Mhm.
a rest day, double it. And then we start talking about the nuances of what are you doing?
Yeah. And the quality of the protein, I assume, right?
Absolutely.
Yeah,
Yeah, it's all
exactly.
hitting that about 2.7 to 3 grams of leucine per 20-gram serving.
Mhm.
And that also brings us back to your amino acids, essential amino acids, branched chain amino acids. It's I tend to look at it, it's like, yes, we all need the essential amino acids. Like branched chains by themselves doesn't really do much because you need the other essential amino acids to have them work from a neurotransmitter and tipping point of view. I often have women who are going out for long endurance sessions, long endurance rides, put essential amino acids in their bottle because we see that protein and amino acids help expand all water compartments in the body,
Mm.
but it also helps with fatigue. I don't know about men because I haven't looked into that. Sorry. But I'm just really looking at what can we do to help women with it
Yeah.
tail end fatigue of a 4 hour ride. How do we help them recover for the next session? So, with essential amino acids, you have all these people like, oh, use them instead of, or use collagen protein and essential amino acids. Like, neither one of those is going to cause muscle protein synthesis.
Mm.
We might need to gaff a vegan protein with some essential amino acids to boost up that leucine content, but not just EAAs, and definitely not collagen protein because it's not a protein that's absorbed for muscle protein synthesis.
Mhm.
Yeah, I was actually going to touch on that whole plant-based versus animal-based because we do have some vegan listeners and plant-based, and that it kind of got to the conclusion. But can you just kind of give us your conclusion one more time? Plant-based protein versus that animal-based in those windows?
It's about the leucine content, right? So we want to have that 2.7 to 3 per 20 grams. So if you're using a pea protein isolate as your vegan protein powder, you need to add some hemp or you need to add some EAA to boost that leucine content. When it talks about overall diet choice, we see that, it doesn't really matter if it's plant-based or animal-based, as long as you're hitting that quality of leucine. And the caveat there is a lot of people who are fully plant-based get too full before they
Mm.
get the adequate protein. I think that's the new documentary that's going around. You Are What You Eat, the twin
Mm.
study. That's
Mhm.
a big misconception because it's the same producers as the Game Changer, and they leave out the nuances of when you actually look at the paper and you look at the results. The only significant difference was in cholesterol, but we see that the male twins both lost lean mass. The Filipino women both lost lean mass. So the weight loss coming from the vegan diet was a lean mass. It's
Mm.
not something that's discussed. So we have to be aware that people who have a really high fibrous diet, one, might not get enough calories, but two, might not be getting enough of that quality protein. And full disclosure, I mean, I've been vegan since I was 14. So
Yeah.
I don't have an agenda here. I'm just like, okay, we
Right.
have to look at the science
No,
and have
you
everyone
present,
do,
yeah, yeah.
yeah.
That's what we love about, well, one of the things we love about you so much is
Yeah.
you're very transparent. You're like, listen, this is what the science is telling us, and this is
Yeah.
kind of where we're at. And
Mhm.
you do talk a little bit about gut health and
Mhm.
hormones in females. And there's a term I doubt our listeners are going to know what this is. So I'd love for you to just kind of do a short little blip on the microgenderome. Can you tell our listeners what the heck is this?
What is that? That's the difference in gut microbiome, right? And we see that there's a significant difference in the diversity between men and women. And it really has to do with the way our sex hormones are metabolized. So most people think, oh, our ovaries or our testes are throwing out estrogen, progesterone, testosterone, it goes and does its thing. Yes and no. The second part about it is we have a second pass where it's taken up in the liver, bound by sex hormone binding globulin, and then excreted into the intestines with bile, where our little gut bugs unconjugate it and shoot it back out.
Mm.
When we start having things like low testosterone through overtraining or age or other issues, or for women, we start going through perimenopause, we see a significant decrease in the diversity because we don't have as much of those sex hormones coming in to stimulate the growth of those bacteria.
Mm.
And we see that in the perimenopause populations in the research, that one of the driving factors for body composition change is this drop in the diversity of the gut bug. So when we start seeing an increase in that visceral fat and abdominal adiposity, sorry, we really want to look at the gut and we want
Mm.
to increase the diversity of the gut. And that doesn't mean over-the-counter probiotics. That means like your prebiotics, your good foods, which you guys always talk about, your deep gut fiber foods, and then having your fermented foods to really hammer home that diversity. But then the other thing is the kind of exercise that you do too. So we know that strength training increases the diversity of some kinds of the gut bugs, and endurance increases the diversity of another kind. But you want to do both so that you decrease the amount of obesogenic or your Firmicutes type phyla. So strength training, endurance training, lots of fibery foods, doesn't matter what age you are, but it really does help with that gut, which then is overall brain health, heart health, body composition, recovery, stress, all of the good things that our gut helps us do.
Isn't it funny? Like it always comes down to it sounds like when I work with athletes, it sounds like I'm saying such basic recommendations, but there is so much science behind this. And it's just, it's not just, it's something more than just, oh, hey, eat your fruits and vegetables, go do aerobic exercise, go lift some heavy stuff, like blah, blah. Yeah, I almost feel like it's like blah, 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 blah. But
Yeah.
there's like true science behind this, guys and girls. I mean, this
Like,
seriously, this is like it.
it's too easy.
Yes,
Uh,
yes, yeah. And
Eh?
then we're not believable enough. I don't know what it is. We're not smelling snake oil or something, I think. I don't know.
Yeah. You're making it overcomplicated and you don't have all these supplements to sell. So obviously what you're saying isn't true.
Yeah. That's
yeah,
that's
speaking of that,
that's true. That's true.
yeah, exactly. I'm thinking of sleep too. Like we say,
Yeah.
get enough sleep, good quality sleep, have your wind down routine and, all these parameters to set ourselves up for quality sleep, good recovery, and so on. But it can fall into that blah, blah, blah bucket. But
Absolutely.
I
Yeah.
know, but Stacey, it's making me think of the wearables or the Aura Ring, Whoop, all the gizmos and wearables with regard to female athletes throughout the aging continuum. Where are we at these days with those gizmos being helpful either to guide recovery, any determinants there in decisions that we make? Can we use those things to our benefit?
We can use them for
Mm.
tracking trends over time. I work with a couple of wearable companies to tell them what's wrong with their algorithms because we
Mm.
Yes.
see that the algorithms are based on male data and
Mhm.
AI is learning from male data, and the prompt engineers are also male. So when we're looking at the algorithms, if you are a female, your things like the rest interval of the QRS interval of your heart rate is different from men. So it's
Mm.
perceived as an anomaly. We see that there's a change in the autonomic nervous system between menstrual cycle phases, oral contraceptive pills, and it's perceived as an anomaly. So when we're looking at the data, for women, we have a lot more missed opportunity of recovery where we're not recovered well. So many women will say, like 3 or 4 days before my period starts, I'm always in the red. I cannot recover. I'm always in the red. And it's not because they aren't recovered, it's because the wearable is perceiving their autonomic nervous system as being too stressed, but it's actually normal. So I tell them, if you really want to track adaptation and training, you want to look at your trend over time for a follicular phase versus trend over time for the 5 to 7 days before your period starts again. because that's going to give you a better indication of your stress and stress resilience rather than the day-to-day comparison that these algorithms are giving you because it's not real information. So we still have a really long way to go.
Mm.
Femtech is starting to catch up, but that's all really for fertility and
Yeah.
tracking infertility, OBGYN, telehealth, that kind of stuff.
Mhm.
But when we're talking about the Whoops, the Auras, the Garmins, they still are basing everything on the male data. So we're seeing some inroads with some of them where they're really backtracking and saying, how do we understand female physiology? Can we look at temperature differences and heart rate variability differences to retrospectively say you may have ovulated at this point, so we can divide your phases? And then we're going to track follicular, luteal, luteal. There's a lot of backtracking going on right now. So I'll be very interested to see what happens in maybe 2 years when everyone relaunches their wearables specific for women.
Yes. Yeah, I can relate. I'm an Aura Ring user and just putting myself out there like newly postmenopausal, but like in the heat of, oh, no pun intended, but maybe so. But like in the prime of perimenopause, my data showing and some of the messages that were being delivered to me,
All
I was like,
negative.
I was like, I don't know if this is true. For my situation, but interesting to
Exactly.
track the trends over time to that point. So important to use it for that purpose as well.
Because we see a significant decline in heart rate variability as women are going through perimenopause.
Oh,
Part
yeah.
of it because they're more sympathetically driven under stress. And
Hmm.
then it changes again once they hit postmenopause. So
Yep.
then they end up with a new baseline. And people don't understand that. They're like, what's going on? I'm so stressed out. I can't sleep. I can't recover. I'm not training well. So it's like, no, put that wearable aside. Let's go back to rating of
Mm.
perceived exertion. Let's look
Yes.
at sessional RPE. Let's see your resting heart rate when you wake up. Let's go back to some basics.
Yep.
And I think a lot of people are like, "What are you talking?" It's the simplicity about it, right? It's like,
Right.
Yes.
but
It's
Exactly.
too easy, so it
yeah,
won't work, right? It's
exactly.
that
Yeah.
message. Yeah,
Yeah,
yeah.
exactly.
I hear that all the time. I mean, it sounds like if I were to pick out, based on what you just said about wearables, I would pick out one word to describe things, and it would be tracking, right? How
Yes.
important tracking is, right? And from a menstrual cycle, like using an app or pen and paper or whatever, and just tracking, like maybe the wearables aren't where they need to be right now, but for you to gain more information into your body would be great, but don't overanalyze, don't overuse. And, like you, Stacey, I see so many athletes just kind of having some false data almost sometimes, and it creates false confidence sometimes, like if they are in the red or if they're in the green and they're questioning things and should they go out to lift today, should they, so I do
Yeah.
feel like we do need a couple more years. I can't wait for those to come out for sure, because it'll, I don't know, it's not going to solve anything, but it's just going to help females so much more just understand their bodies.
I want them to change their language, regardless if it's
Yes.
male or female. But you never tell someone, don't do this, right? You have a
Yeah.
recommendation with a positive scope so people can make informed decisions and not feel guilty. Because
For
right now,
sure.
all the wearable feedback is all, you shouldn't do this, you shouldn't do that. And it's
Hmm.
not taking the whole mental capacity into play.
It's so true. I mean, it,
Yeah.
it kind of does mess with your brain sometimes. I mean, I've worn some of these and I'm like, no. You get up in the
Exactly.
morning, you're like, it's showing me I'm in the red. And then you assess yourself, and then maybe you start training or exercise. You're like, man, I feel great. This is the best I've felt ever, right?
Hmm.
So
Yeah.
obviously I mean, biology is so intricate, right? There's so many things going on. I mean, I feel for these companies trying to develop these wearables because I don't even know how you go about trying to pinpoint some of them, but kudos to them for trying to help us understand our bodies better.
Yeah, exactly.
Yeah,
Yeah.
yeah. Well, Stacy, before we move to our high fives, giving us each other high fives, giving you a high five for this awesome, awesome episode. Anything that we either forgot or just you wanted to make sure we snuck in here to mention and that we didn't already chat about yet?
I don't think so.
Okay. This
It's
this
like,
is pretty good. No,
hmm.
we specifically wanted to go a little bit more variety on this episode with you, and I think we did that, and hopefully our listeners, you all appreciate that. But we'll make sure, obviously, we put all the links and all these great references in the show notes. But let's finish up with our high five. I don't know if you remember these from a couple years ago, but we're going to give you a virtual high five by asking you rapid fire questions. Now, of course, you don't have to rapid fire answer us, but they're going to be rapid fire questions if you are ready.
Let's
Okay,
go.
Dina, drum roll, please. I know you play the
Okay.
guitar. Give me a drum roll.
I'll spare the drum roll because, yeah,
Okay.
my timing's off.
All right, Stacy, question
Did-
number one. You are an amazing athlete, amazing person, amazing athlete. But here's the question. If you were to learn one new sport or activity right now, what would you want to learn?
Kite sailing.
Kite
Oh,
sailing.
Yeah,
Whoa.
because I live by the beach and it's super windy, and I see
Oh,
all
yeah.
these people kite sailing.
yeah.
But more than that, they're kite sailing on a hydrofoil. So you see like
Oh,
this
cool.
the foil surfboards is like trying
Oh,
to surf on a Swiss ball.
Yeah,
But now
yeah.
they're kite sailing or kite surfing
yowza.
on a
Oh,
foil. I'm like, I want to learn how to do that, but
so
Ooh,
I don't
cool.
think yeah.
wow.
So
Okay. Well, we'll look forward to seeing some photos of that. Not sure. Question number two. All right. Put your imaginary hat on for a second.
okay,
But since you
okay.
do live near the water, you're stranded on a different island, a deserted island in the tropics. And you're gonna be rescued, Stacy, but in the interim, you don't know when or any of that. But what are three things that you'd want to have with you to get through your time on this deserted island?
Music, preferably like one of the Rova apps or something so you can scroll all the different genres of music.
Oh, nice.
Um, some kind of shelter. Can I say that is one of the things? I want some
Yeah.
kind of
Mm-hmm.
shelter.
Mm-hmm.
And a whole avocado and walnut and peach orchid so I
I
can
love,
pick my fruit.
love
Then
it.
I'd be happy.
Uh, that's awesome. You could probably stay there for a while.
Yeah, but the shelter has to have an espresso machine with unlimited espresso.
It'll be
And then I
So
solar
kind of,
powered.
yeah,
yeah,
yeah.
exactly.
So you kind of want a hotel on this deserted island, is what I'm hearing.
Yeah. Yeah,
In a
exactly.
grocery store
Yeah.
with
We
just
camp.
avocado and walnut
We
and
just
peaches. Yeah.
glamp. Yeah, so it's
I
Yeah.
mean,
glamping on the desert island.
we can dream that.
Yeah,
Perfect.
okay, good.
Okay, question number three, a little bit easier for you. What's a kitchen gadget that you just cannot live without?
I think I answered it, right?
I think
Espresso
you did
machine.
too.
Yeah.
Yeah, I thought you
Yeah.
were going to
Mhm.
say that. Yeah,
Yeah.
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 Yeah. Stacy, how about your wind down routine? If you have one currently, does it depend on like a weekend day or a week work day, night? What's it like?
Well, it's all the same because my daughter, even though she's 11, she still likes to have chat and story time. But it's
Oh,
not necessarily, so I don't want to break it because it's really good where she's now asking questions she doesn't want to ask anyone else. So I keep that as part of my wind down time where we have those conversations. And then I get ready for bed and I get into bed and I read, but nothing sciencey. I'm reading things like Dave Grohl's The Storyteller, which is really funny, so
nice.
things that you can fall asleep to that is very lighthearted and positive, and that's it.
Love.
That's great. Yeah. So we did ask this question to you last time, but since it's been a while, things change.
Mhm.
What's if you just had one piece of advice for all female athletes, literally one thing to tell them, what's the one
Mhm.
thing you would tell them?
Ooh, learn your body, like
Mm,
through tracking,
Mm.
understanding who you are from a personality and what drives you. Because if you are empowered that way, then anything thrown your way, you can handle.
love it. Love it.
Amazing.
Yeah,
Oh,
such a powerful message. And Stacy, you are, I mean, such an awesome person. I mean, I do want
Oh,
to say that
thanks.
because I think it just a lot of people see you in the press and they're like, oh, Dr. Sims, she's great. And but you really are great. I mean, not just as a scientist and a researcher, but you're just a great person. You're a mom. I mean, you name it, right? You're kind of that all around person. So we just want to say like heartfelt thank you from our hearts. And we just so appreciate the time you give us, every so often. And we will put, again, all the references in our show notes, put a link to the updated Roar version. We do want to make sure we get our listeners reading that for sure. But yeah, just thank you
yeah.
for being here.
Did it. And it's great to see you.
Yeah, you
Thank
also,
you.
you also, and thank you for continuing to push the limits. I'm all about that in our field to try to bring more, more knowledge and more awareness. So we do appreciate that, listeners. We hope you really enjoyed this episode. It's always fun talking to Stacy and learning from not only her great experience, but also looking into her crystal ball, like Dina said earlier. So thank you for listening to this episode. We will catch you on the next one.